My name is Hugh McMillan. I'm a pediatric neurologist and neuromuscular specialist at Montreal Children's Hospital. And I thank you for giving me the opportunity to speak to you today about SMA and newborn screening. I started working 12 to 13 years ago as a pediatric neuromuscular specialist, and at that time, children who were born with SMA were born with a fatal condition, where children with type 1 SMA, the most severe infantile form, would live on average of 8.5 to 10 months of age. And the majority of those children would not be expected to live beyond 2 years of age. But there's been a dramatic paradigm shift that's happened over the last few years, where children with SMA now have access to 3 effective therapies to help to modify their disease: nusinersen, omnisenogene abeparvovec, and risdiplam. We know from the studies that have been done with all of these therapies that early treatment is best, and particularly data that's come from the SPRINT trial with omnisenogene abeparvovec and the NURTURE study with nusinersen, that if we're able to begin treatment prior to symptom onset, it can have a massive effect in terms of how these children do. That then gives rise to the whole concept of newborn screening, where we can diagnose patients who have SMA prior to the onset of symptoms. Newborn screening has been available for decades in most jurisdictions, most countries. And initially, when newborn screening was started in many jurisdictions, it was started for 2 critical diseases: PKU and congenital hypothyroidism. And those are 2 conditions that children can be diagnosed before symptoms develop. Treatment can be implemented, and those children will have a dramatic shift. Instead of natural history running its course, where these children have profound cognitive impairment, inability to speak, talk, or understand language, they're cognitively normal if treatment is implemented early. That is exactly the same as what we see with spinal muscular atrophy, and the need for us to be able to make this diagnosis at an early stage. Newborn screening for SMA is now in part or all of 11 countries and in 44 of the 50 US states. 95% of the children born in the United States of America are tested for SMA as part of newborn screening. In Canada, Ontario was the first province to begin newborn screening. It's been screening now for over 2 years, and other provinces are beginning to show interest and are at various stages of the process. I've worked in 2 different jurisdictions. I worked in Ontario when newborn screening was implemented, and am able to comment firsthand on how wonderful it can be to make this diagnosis and implement treatment before the onset of symptoms develop. I'm currently working in Quebec, where although there are plans for newborn screening in the near future, it's not part of our day-to-day reality right now. And by comparison, I'm seeing children who are born with SMA, who have developed symptoms, and who are then referred to me, often with quite significant floppiness or hypotonia, as well as significant weakness. And in that context, by offering these disease-modifying therapies, I'm able to help to arrest the progression of their disease, potentially offer them some very modest clinical benefit. But I'm not able to offer them the same chance at being able to sit or walk or run that would have been the case if the diagnosis had been moved up earlier, shortly after they had been born. I'll leave you with a patient that I was fortunate enough to be part of his new reality when newborn screening came into place in Ontario. This patient that I'll show you is the first patient that was diagnosed through the newborn screening program. And you'll see, I met him at 7 days of age. He was diagnosed and he was treated with omnisenogene abeparvovec quite promptly before any symptoms developed. And you'll see in the video how normal this boy looks. Without treatment, this boy would not have been able to walk. With early treatment, you'll see for yourself in a moment in the video how well this boy is able to run, manipulate things with his fingers, and how normal he looks, both from a gross motor and a fine motor perspective. And for families, that's really what matters, is for their child to have the best chance in life to be able to do as much as they're able to do. And that's what we're able to offer with newborn screening in SMA, by including that in the platform in all of the provinces in Canada, all of the jurisdictions and countries where we're able to do so. So I thank you.